Good evening. Thank you for joining us once again tonight for our 18 News digital exclusive State of the Virus. Now, as cases of COVID-19 continue to rise across the country, 18 News is giving you, our local viewers, an opportunity to ask local experts your questions regarding COVID-19. And today we're joined once again by Dr. Justin Nistico, an infectious disease physician at Arnett Health. And thank you for joining us once again, Doctor.
Yep, thank you for having me.
So, Doctor, every day we're seeing reports of more than 100 cases being reported in Chemung, Steuben, and Schuyler County combined. The governor says that there will be a stronger emphasis on hospitals and their capacity. So what is the state of the virus here in the Southern Tier, and how are you guys in the hospital handling this?
So currently, the way that the virus has been evolving is that we're seeing a lot of cases and clusters throughout the areas, and we're noticing that there has been upticks in specific regions such as places like nursing homes and even post-holiday infections because people had been gathering. But what we have been doing in the hospital is we've been having a steady stream of patients come in being treated for COVID-19, and we are treating those individuals with the appropriate treatment now, which has been FDA approved, which is that remdesivir, and also we're catering the treatment for certain individuals. They may require other treatments other than the typical treatment such as remdesivir.
Okay, Doctor, so we have our first viewer question, and this one comes from Amanda in Big Flats, and she noticed that this hospitalization, or the number of hospitalized patients, continues to rise and hasn't changed much. So how long are people typically staying in the hospital before they do recover?
So the typical time frame in which individuals may remain in the hospital can be variable. Depends upon when the patient presents to the hospital with this infection. The earlier the onset of symptoms start when they get diagnosed, they may get treatment right away and they may have a much shorter duration of hospitalization. If you come much later on in your course of infection and you're feeling very sick, or if you're at a point where you're the sickest, those individuals may remain longer because they may require more intense therapy. Really, what it comes down to is that you should just be monitoring your symptoms closely. And if you're feeling ill enough, or if a family member is concerned, getting people medical care or even speaking with your primary medical provider might be key in reducing the hospitalization length and stay, and also reducing complications from this particular virus.
All right, so you mentioned remdesivir. What are the other kinds of treatments people are getting? Are there certain steroids that go along with remdesivir, and is this something that just depends on the patient, or is it the state or CDC that's recommending these?
So there are a variety of outlets that have recommended different treatment modalities, but there is in the works treatments now that include remdesivir, which is an antiviral medication that attacks the virus. There is steroids that we have given to help with some of the inflammation. There have been other treatments which include some anticoagulants or medications that reduce clotting in some patients. And also now on the horizon are some of these antibody treatments or monoclonal antibody treatments that are preventative, which have been, through the FDA, something called an emergency use authorization. So it's a matter of, there are many different treatments now. We also have something called plasma as well, convalescent plasma, which we have used in the past. But nowadays, the treatments keep evolving, and we may have, in the horizon, even better treatments. So, which we're kind of waiting and, hopeful for.
I bet it'd be great to have. And we have another viewer question here, this one coming from Tabitha, and she would like to know, what is life like for people who recovered from COVID-19, whether they're asymptomatic or they are hospitalized? So what are people looking at once they do recover?
So once individuals recover, it could take a variety of, there's variation into how people get better. Some individuals may start feeling completely asymptomatic right away after they receive treatment in the hospital, or even if they're home. It may take several weeks to recover or get back to a better baseline. Life after COVID, it could take a while to kind of get back to your normal, what is known to you as your baseline functionality. but people are getting back to normal. I have had multiple conversations with individuals where people have gone back to doing things like work, gone back to, activities that they normally would do, and they also have the same type of exercise tolerance, which means that when they go up steps or when they walk around, they're not feeling short of breath like they were when they were sick.
All right, and we mentioned this rise in COVID cases and the holiday season. How much of this current wave can we trace back to Halloween? And of course, with Halloween, it's a very child-centric holiday. So have we also seen a rise in cases among children since Halloween?
Not particularly. It's interesting that we do see that there has been some spread associated with these holiday seasons, especially from prior holiday seasons, even seen in other countries. But what we've actually noted is that with children, for whatever reason, we haven't seen large outbreaks amongst populations of children. But that doesn't mean that it can't happen. It's just that we just haven't seen it or it hasn't been observed. There can be some protective quality amongst children, but it is yet to be studied. And we're trying to figure out what makes there to be such a difference amongst young kids. But the one thing that is important to just note is that if you are gathering, it is important just to protect yourselves and make sure that the gatherings are not too large. Because what tends to happen is that people go for the holiday season, visiting family members, friends, etc., and they can cause infections amongst those individuals where they may not even realize they're sick, because those are the asymptomatic spreaders. And if you have a large group, it could be something called a super spreader event, where you may have this large gathering that could spread the virus pretty rapidly.
Right, and doctor, with that being said about the children, how safe are the schools for kids, and how frequently can they transmit this virus amongst themselves? Can they transmit as frequently as adults? And if the children aren't transferring as frequently between themselves, what about kids to teachers?
So there's definitely a concern there. I think with children, they could they are getting sick with COVID-19, but the actual symptoms that they may present with may not be as severe. And the concern there is that you might have a teacher who can be, immunocompromised or older, and those individuals could be at risk. But I think schools have been taking the approach of having a online presence as well as having an in-person presence. And I think it has been something that has helped keep some of the spread of this virus in schools, to a minimum. The one thing that is just important to note is that they're trying to come up with new ways to keep everybody safe, including teachers, people who work in the school, and children, so that I think it's important if if they're doing these things where they're doing half online and half in person for the time being, there will come a time, I think, when things will revert back to a normal state. It's just that at this time, I think this is the best approach for it.
And doctor, we've also heard a lot about, of course, the winter weather is coming in, the colder weather, and we had one of our first big snowfalls here overnight. What effect does the winter weather have on people either contracting the virus or the virus potentially getting worse? And what kind of damage could the weather have for us being able to flatten the curve once again?
So, especially with the winter weather, not necessarily the presence of cold or hot temperature wise, it comes down to actually individuals that have to be indoors, because with the cold weather, people spend more time inside, especially if they're going to be at someone's house. They can't really get together outside of the house if the weather is bad. And those particular events are events that could cause increased spread, because you're now in a confined space as opposed to being outside where there's fresh air, there's breeze, and COVID tends to be disseminated or spread less likely outside. The importance of just the winter, I think, is more or less making sure that you have you stay safe. You're not causing too much of spread, so you're trying to do safe activities. And if you're with your family, the important thing is just to note that, if anyone is to come into the house, just to make sure if they're not, to wear masks, to wash hands, and to make sure that you're doing your part with social distancing. But indoors tends to be where the spreading is occurring in this colder weather.
All right, and we've also heard a lot about these pharmaceutical companies talking about their vaccines, some of them saying that they're more than 90% effective and that they are safe. The UK just announced today that they're going to approve one of these first vaccines that has come out. And Governor Cuomo is saying that New York could see its first couple doses of the vaccine come out later this month. So what is the state of the COVID vaccine here, and when could we expect to see one, not just in the nursing homes, which is expected to be that first wave, but a general population?
So I think in the beginning, once the FDA puts its a approval or an emergency use authorization on the vaccination, there might be doses of the vaccine readily available to give to what they consider high-risk populations. And it has been noted, even by the CDC's guidance, that there has been interest in giving it to healthcare workers and also nursing facilities, just because these areas tend to be high levels of spread. Or individuals working with COVID patients can have high levels of spread. So the importance to present it to the general population is once there is appropriate approval and it's considered or deemed safe by the FDA and by the state, that we would essentially start seeing it rolled out for the general public. But I think in the early stages or the beginnings of rolling out the vaccine, we might only see it in patient populations that would be considered highest risk for spread, and then eventually hit the general population.
All right, and of course, in between the time to get the vaccine, people remember, wear your mask, social distance, and follow all those procedures that we've talked about. Doctor, thank you again for joining us today. And viewers,
Yeah, no, thank you.
Viewers, if you have a question regarding COVID-19 that you would like one of our local experts to answer, you can email us at news@wetmtv.com. And of course, we'll have more on the fight against COVID-19 on 18 News and on mytwintiers.com. Thank you for joining us, and have a good night.